Today's our topic is myocardial infarction. Myocardial infarction or acute myocardial infarction, generally known as heart attack, is it interferes with the blood supply to the part of the heart, causing some heart cells to die. Commonly, it is known as heart attack. Occurs when the blood flow decreases or stop to a part of heart. It leads to damage to the heart muscles. Death of myocardial cells due to the ischemia lasting more than 20 to 40 minutes leads to heart death, confirmed by elevated cardiac biomarkers, troponin and CKMB, that is creatine kinase myocardial band. These are two biomarkers which can specifically tell about the death of the heart cells on ECG changes with clinical symptoms. Key pathological features are coagulation, necrosis of cardiac muscle. There is an inflammation in the cell leading to scar, decrease in cardiac function. Basically, there is a cell death. Then this can lead to scar, inflammation in the cell, less supply of blood to the heart, less oxygen to the heart cells, and decrease in cardiac function. Next is the causes of myocardial infarction. There are three types of causes. Some are primary causes, modifiable or secondary causes, and some are non-modifiable causes. First is primary causes. Primary causes, first is atherosclerosis. There is a plague in the artery. The inner dia of the artery decreases in this case. Coronary artery thrombosis is the second cause, that is a clot formation in the artery. Coronary artery vasospasm, there is an inflammation. Deposition of fat in the artery is also a blockage of the artery. And decrease the blood supply. Obviously, if there is an blockage in the artery, then decrease supply to the heart muscle. And if there is a decrease in supply, then there is a decrease in oxygen, that is known as hypoxia. Secondary causes are the causes which are not primary and due to the other disease in the body, like hypertension, hyperlipidemia, increased level of lipid in the arteries, diabetes mellitus, smoking, chewing tobacco, obesity, decreased level of physical activity. Non-modifiable, these are modifiable. If you can change if you can treat the hypertension, hyperlipidemia, diabetes mellitus, then you can also treat the myocardial infarction also. But there are some cases, some causes, these are non-modifiable. Non-modifiable means if there is a myocardial infarction or there is a blockage in the artery in the age up across the 50, then it is not modifiable, है ना. Family history of coronary artery diseases, if there is a family history, genetic disease, then you cannot change. In some cases, this is also caused by post-menopause symptoms. Next is the types of myocardial infarction. There are basically two types, but you can classify into the four types. First is transmural infarction. Transmural infarction refers to myocardial infarction that involves full thickness of myocardium. There is a full blockage in the artery. Complete occlusion of coronary artery slow down the ST elevation. ST elevation is shown on the ECG machine. ECG line is above the base level line. Okay, it is a medical emergency. You can immediately go to the hospital. Second is the non-transmural infarction. A non-transmural infarction, myocardial infarction, alludes to a myocardial infarction that doesn't concern with the full thickness. There is not a full thickness, there is a partial thickness between the myocardium. It is a partial occlusion, no ST elevation, no changes in the ECG machine. It can be managed by giving anticoagulant. You can give the anticoagulant drug, prevent the clot, and then you can go to the hospital. Third is silent myocardial infarction. It occurs without any pain in the chest. कॉमन इन डायबिटिक्स, जो डायबिटिक के पेशेंट हैं, एंड एल्डरली पर्सन, इट इज़ डायग्नोस्ड बाय ECG. Last is the type 2 myocardial infarction. It is caused due to the increased oxygen demand, but there is a clot or there is a occlusion between the artery. There is less blood supply to the heart. If there is a less blood supply, then obviously there is a less oxygen to the supply to the heart, but there is an increased demand from the heart. If there is increased demand and less supply, then it is also cause to myocardial infarction. It is in the case of anemia, arrhythmia, hypotension, tachycardia. These are the condition in which there is a increased oxygen demand is there. Then is the pathophysiology: severe arterial occlusion, severe vasospasm, atheroma. Atheroma is a buildup of fatty material in the arteries, fat deposition in the artery. These all three do the reduced blood flow to the heart that causes myocardial infarction because there is a less blood flow. Deficient in pumping, it causes to congestive heart failure, death or shock. Next is the symptom and diagnosis of myocardial infarction. Symptoms are: there is a severe pain in chest, discomfort which may travel into the other parts such as shoulder, arm, back, neck, jaw, shortness of breath, fatigue, diaphoresis, that is profuse sweating, angina, anxiety, sweating, restlessness, heartburn. These are the common symptoms of myocardial infarction. Other symptoms also include nausea, feeling faint, cold sweat, feeling tired. These are the common symptoms of myocardial infarction. Diagnosis: you can diagnose it with ECG, as we already read this already in this ECG machine. Troponin level, you can check the troponin as a biomarker which you can check if there is a occlusion in the artery or not. Echocardiography, coronary angiography, you can check the blockage through angiography also. CBC काउंट, कंप्लीट ब्लड काउंट जो है हम लोग चेक कर सकते हैं इफ़ देयर इज़ अ हाइपरलिपिडेमिया और नॉट. लिपिड प्रोफाइल चेक कर सकते हैं. LDH लेवल जो है, you can check the LDH level. Lactic dehydrogenase also you can check. BNP, that is brain natriuretic peptide. This is also a biomarker for heart failure. You can check the myocardial infarction. You can diagnose with these tests. Next is non-pharmacological treatment. Non-pharmacological treatment, you can use the reperfused therapy, oxygen therapy as in case of less oxygen supply to the heart. Dietary modification, you can change the dietary recommendations. Decrease the saturated fat, decrease the sodium intake, decrease the alcohol. You can avoid the trans fat in the diet. Surgical treatments are also there. Surgical treatment is bypass surgery. Cardiac rehabilitation center, you can go to the cardiac rehabilitation center where there are various yoga exercises, lifestyle counseling. By this you can increase the quality of your life and decrease the mortality rate. Lifestyle changes are like you can do at your own also. Stop smoking, regular exercise, stress management, adequate sleep. Manage the secondary causes of the disease like BP and diabetes mellitus. Next are the pharmacological treatments. You can use the antiplatelet count that prevents the thrombus, like aspirin, anticoagulants that prevents clotting, heparin, thrombolytic agents that dissolve the clot, streptokinase is an example. Beta blockers decrease the BP, decrease the oxygen demand. If there is less oxygen supply, you can also decrease the oxygen demand to the heart. Propranolol, atenolol are the common examples, common drugs. ACE inhibitors हैं आप लोगों के पास, decrease the load of the heart, heart का load जो है वो कम कर देते हैं. Ramipril. Statins हैं, statin decrease the LDL cholesterol and plaque in the arteries. Atorvastatin है. Nitrates हैं आप लोगों के पास, vasodilators का काम करते हैं, decrease the oxygen demand. Nitroglycerin. Morphine and analgesic, morphine sulfate is an example, reduce to the pain and anxiety. In this way you can treat your myocardial infarction. Thank you.